Ogagba, Kunle the Olofofo specialist. Welcome, oh.
Doki, kí ló happen, baba?
Kunle are gentle, oh. We thank God for his mercies.
Doki, wahala dey o. Wetin dey happen for this life?
Gist merchant. Want to today, oh. Wahala. From where and what about?
Doki, how dem go carry small pikin go do dialysis? I think say na only adults dey get kidney problem o.
No, Kunle. It's not true that only adults can have kidney problems. Children can too.
Na wow, Doki. Wetin dey cause am?
Well, Kunle, there are several possible causes of kidney disease in children. Firstly, any situation that causes a rapid reduction in the amount of fluid in the body or reduces significantly the flow of blood or oxygen to the kidneys, such as diarrhea and vomiting, among other causes, can lead to kidney injury. And one of the first things that can be noticed is that there is significant reduction in how much urine and how frequently the urine is being passed by this child.
So ordinary diarrhea and vomiting for children fit make their kidney get problem?
Sure, Kunle. Diarrhea and vomiting, especially in children under the age of 5, is a very serious issue. And while the causes may vary, common to the treatment of all cases of diarrhea and vomiting is to replace the fluid and something in the blood we refer to as electrolytes that are being lost in the body while trying to identify the cause and treat appropriately.
Okay, Doki. How dem dey replace this fluid and electricity, abi wetin you call am, wey these children dey lose when dem dey vomit and stool?
Well, the first step is the use of oral rehydration solution, which can be constituted using prepackaged oral rehydration salts, or in absence of that, which is usually available in most drugstores around us, you can prepare a homemade salt sugar solution. The solution has to be correctly constituted and given to the child as much as the child is willing to drink, to the minimum of about what the baby is vomiting or stooling. And in case of vomiting, 5 to 10 minutes can be given after the episode and then ORS is given. However, it's important to note that that child must be promptly taken to the hospital where health professionals will properly examine the child and determine if the child can be rehydrated orally and how much needs to be given, or if this child needs to be given fluid and electrolytes through the vein.
Doki, how dem dey make this salt sugar solution for house?
Well, the World Health Organization recommends that 8 level teaspoons of sugar and 1 level teaspoon of salt be added to 1 liter of water to constitute the homemade salt sugar solution. However, the WHO recommended oral rehydration therapy salts are readily available in most pharmacies and drugstores around us.
Okay, Doki. Any other thing dey wey dey cause kidney problem for children body?
Yes, Kunle. An injury to the kidney resulting from reduced fluid in the body can become so severe that just replacing the lost fluids and electrolytes is not enough for the kidney to return to its normal function. And there are other kidney diseases that may occur, some that have some genetic component, that is, they run in the family, or some that have no identifiable cause. However, a major cause of kidney problems in children is due to abnormality in the formation of the kidneys and the tubes that pass urine from the kidneys to the bladder and from the bladder to the exterior while the baby is still in the womb, due to different causes. Most of these abnormalities tend to cause some kind of obstruction in these tubes, which over time results in kidney injury.
Na wow, Doki. Ọ̀rọ̀ pọ̀ nínú ìwé kọ́bọ̀.
True, Kunle. Anyway, I can't but mention some practices that predispose children to kidney injury. First is the use of herbal concoctions, which Yoruba people refer to as agbo, and then there is use of bleaching creams and soaps and things of that sort that can predispose children to having kidney injury.
Doki, dey your deal. You won't make all our mama and grandmama catch you. Leave agbo alone, no.
Kunle, listen and listen well. We can't leave the agbo matter. The damage that is done is often worse than any good that it can do.
Doki. You sef know say good dey there, abi?
Well, Kunle, this is how I like to explain it so that people can make an informed choice. You see, the drugs that we prescribe as doctors, whether tablets or syrups and injections, are based on thorough research. I'll give you an example. If we find out that a so and so plant is said to treat malaria when it is prepared in a concoction. We take that plant to the lab and we separate the contents. Now let's assume that the contents of that plant are items A, B, and C. We take A separately and use it to see if it can truly treat malaria in the lab. If A treats malaria, we note it and we put it aside. Then we test B. Then we find out that B doesn't do anything. But before we jump to any conclusion, we add B to A to see if they work together. And then we discover that by adding B to A, A's effect in treating malaria is more efficient. Then we take C and we test it and we find out that C is a poison. It doesn't do anything useful. So what do we do in conclusion? We totally take C out of the picture. We put A and B together and we try to determine how much of A and B is too much or too little to achieve the results that we desire. That is how we come about giving you prescriptions of 2 tablets 3 times a day and so on.
Wow, Doki. Ó deep gan o. Àgbo ńkọ́?
Well, Kunle, from my earlier explanation, you can see that agbo contains both the good, the bad, and the ugly. And different people prepare these concoctions differently. So the concentration differs. And oftentimes, the poisons in these concoctions go on to damage the kidneys, the liver, and other parts of the body. So as doctors, we do not recommend the use of herbal concoctions at all because we cannot vouch for what is in them and whether they are beneficial or harmful or their doses.
Now wow, Doki. Okay, I don't hear. So shey na dialysis be the only solution to kidney problem?
No, Kunle. Firstly, dialysis can be used to temporarily take over the function of the kidney when there has been a build-up of a lot of harmful waste products or toxic substances in the blood that needs to be gotten out very quickly before it does more severe harm to the body. Afterwards, dialysis may not be required.
Doki, I fear because most of the adults who I know say they do dialysis. Once they don't start dialysis now, na so dialysis all the time. And the money for the dialysis sef na palava.
Kunle, just as in the adults you have described, if the injury to the kidney is very severe, that recovery is seriously delayed or can only be remedied by kidney transplant, which can also happen in children, dialysis may need to continue to do the work of the kidneys pending the time that the kidneys recover or the kidneys can be replaced with a transplant.
So how person wan prevent these kidney problems and how person go know pikin wey wan get am and wetin person go do?
Well, Kunle, it starts with simple things like ensuring adequate fluid intake and treating diarrhea and vomiting in children promptly. And for boys, especially in the first year of life to their early years, the mother needs to be very observant of the urine stream. What I mean is this: usually when boys pee, the pee usually goes high up. And if a mother is changing the diapers of a baby, if she's not careful, the pee can go straight into her mouth. However, in boys who have certain abnormalities in the kidney and the urinary tract, such as what we refer to as posterior urethral valve, which is a blockage in the urine pipe, the urine only trickles down little by little. It doesn't jump high up like it does in other boys. Also, as we said earlier, any significant reduction in the volume or frequency of the child passing urine can be a danger sign. Also, swelling around the eyes or the face, which can also involve the legs, which is noticed more in the morning and reduces as the day goes by, is an indication that there might be something going on with the kidneys. Also, if the urine is unusually foamy or the color changes to red or tea-colored or coke-colored urine, these are things that are alarm signals that should make a mother, a parent, a guardian present quickly to the hospital with that child.
Doki, I don learn plenty today. Now I know say children fit get kidney problem and some of them dey preventable and treatable. Make I go spread the word.
Thanks, Kunle. We'll be looking forward to your next visit. The Olofofo specialist himself, investigative journalist extraordinaire. Ire o.
Doki, you too try. We go to see.